My name is Marencia. I'm a student physical therapist working under Dr. Clausen today. How are you doing today, Grace?
Good.
Good. So we did just go through some treatment for your reconstructed ACL. We noticed that you were having a little bit of a deficit in quad strength, and we noticed that with like the extensor lag in the straight leg raises. Your pain is under good control, so right now I feel like we could use some electrical stimulation for part of the treatment to work on retraining the muscles to get better quad control. We don't need to work on pain right now because you're only 1 out of 10, which is great. So right now with Grace, the reason we would want to do electrical stimulation is to provide the neuromuscular retraining for the quad muscles. We do this by selecting an intensity and duration that stimulates the motor fibers within the muscle, so we get a muscle contraction. And this is just re-educating the brain and the body to work together after that surgery. Some contraindications that we wouldn't want to perform electrical stimulation on a patient is cardiac diagnosis, decreased sensitivity in the area, impaired cognition. We also wouldn't want to do electrical stimulation on the abdomen, hips, pelvis, or back for pregnant females. We also wouldn't want to do it on the area of a pacemaker, on or around the area, and we would want to avoid the carotid sinus. These would all be contraindications to not do electrical stimulation. We've had a conversation with Grace, so we know impaired cognition. There's no contraindications for impaired cognition. Doing a quick assessment of her leg, it looks like there's no decreased skin integrity, no hematoma, no lacerations or wounds. I would also ask Grace, are you all right if I touch your leg and just assess for sensitivity?
Yeah.
Can you feel this right here?
Mm-hmm.
Can you feel that up here?
Yep.
Okay, then I would say we're good to go on the sensitivity of her thigh. Other questions I would ask are, Grace, do you have any issues with the circulatory system or coronary or carotid diagnosis?
No,
Nothing.
you're
Like
talking about my heart, right?
I'm sorry. Yes, your heart. Any issues with that?
No.
Perfect.
I've never had anything like
Good, and no malignant tumors in the area.
that. Oh, no.
And, all right, then we're good with that as well. So Grace, for today, the electrical stimulation is going to deliver a biphasic pulse current through this machine. We're going to put some electrodes on your thigh, around your quad muscle, and it will deliver a stimulation. We are going to go a high enough amplitude that you feel a muscle contraction, and when we do that, we're just going to have your mind and body contract with the electrical stimulation so that it all works together. And then we'll go for about 10 minutes and get 10 really good contractions so we get that muscle working. It can be somewhat fatiguing, so we're going to give you a rest period in between each contraction as well. Does that sound okay?
Yeah, so the electricity is going to contract the muscle?
Yep, it's going to contract your muscle, and then we want you to actively try and contract that muscle as well, just so we can connect all the pieces together.
Okay.
Mm-hmm. And then if you want to lay down or put your leg up here, if that's comfortable, that would give us the best practice. All right, you feel okay right there?
Mm-hmm.
Perfect. And you're okay if I put these electrodes on your leg?
Yep.
Perfect. So assess skin integrity, everything looks good. You're gonna put one electrode at the base of the quad muscles and one on the upper portion. Okay. And then for the parameters, we have the machine on. We want normal biphasic right there. Normal biphasic. We want to deliver a 10 on contraction with 50-second rest. And then we're going to bring the ramp down to 2.0 so it's a little bit more comfortable for the patient. Frequency can be between 50 and 100, and I like to go up to 80 so it's a little bit more of a tendonic contraction rather than have the muscle contraction be somewhat twitchy. And then pulse width, we want it at 200 microseconds. And then I'm going to turn up the intensity, Grace. Just let me know when you start to feel a slight buzz, and I want to walk you through that. But what we're basically going for is a muscle contraction about 60 to 70% of your full muscle contraction. We do want it to be pretty strong, but not painful. And if it feels too much, just let me know and we'll back off a little bit.
Okay.
Okay? So I'm gonna start increasing the intensity and the amplitude. So when you first start to feel that tingling, just let me know.
Yeah, I'm starting to feel a little bit. Yeah.
Okay. So we want to keep going until your muscle starts to contract, but I'll go slow so it doesn't scare you or anything like that.
Yeah, it's getting stronger, but it's okay.
Okay. I'm just gonna put my hand right here just to see if I can feel the muscle contraction as well. Oh, there we go. Think you can feel a little bit more?
Yeah, it's not really fully contracting if that's what you're looking for.
Yeah, we do want a pretty strong contraction, but we don't want it to be painful. Still feeling okay?
Yeah.
Tell me when you want me to stop.
You can keep going.
Still feeling okay?
That's probably about what I can do.
Yeah? Okay, so that's a good contraction. I'm gonna start the timer. So when you feel that pulse or the stimulation being delivered, I want you to push your knee into the table as hard as you can so we can get that contraction facilitated.
Okay.
Good job. And then when it relaxes, go ahead and relax as well. Perfect. So we'll do this about 10 times. So that was one really good contraction. We want to do about 9 more.
All right.
That 50-second rest period is really important because we're just starting off on the electrical stimulation and that muscle can get really tired. So we want an adequate amount of time for rest.
Okay.
This way, when we're stimulating the muscle fiber contraction, we're recreating that pathway from your brain to your body and waking up those motor fibers in your quad. So we're going past those A beta cells or A beta fibers where it's more of a pain control system.
Okay.
You'll probably feel it pretty soon. In about 5 seconds, you'll feel that next contraction.
Gotten there yet? Oh, there we go.
There we go. Perfect. Good job. Yep, push right into that table. I know.
Yeah, it's
hard.
tricky still.
You're doing good. Good job, though. Do you have any questions so far?
No.
Feeling good. Perfect. Good. So we continue with this until we get all 10 of those good contractions. But we're gonna cut a little short right now. Just turn that off. Do you have any other questions for me today?
So this is just stimulating my nerves, which is stimulating my muscles.
Mm-hmm.
Because I can't do that very well on my own yet.
Yeah, just from the surgery, it might have made those nerves a little bit tired, the muscles a little bit tired, and we just want to make sure that we have good contraction of the quad muscle so that we can get you returning back to your favorite activities.
Okay, great, cool.
Okay, perfect. Well, thank you very much. All right, and then we're gonna take those off. I do just want to look at the skin integrity after the electrical stimulation, make sure that there was no warning signs. Doesn't look like there's any red spots or burns, and no new cuts or bruises or anything like that. So I would say that looks pretty good. So we're able to do that next time you come in for treatment.
All right, thank you.
Yeah, thank you.